I'm Hswen, Associate Editor of JAMA and JAMA Plus AI, and you are listening to JAMA AI Conversations. My guest today is Dr. Maria Villalobos-Quesada, a postdoc at National eHealth Living Lab, LUMC in the Netherlands, and an associate researcher at the Observatory Bioethics and Law of the University of Barcelona, whose research is in the bioethics of new technologies that are applied to health, including eHealth, mHealth, AI, and big data. So my first question that I want to start off with is, you do a lot of research in bioethics. So how has that really changed when it comes to AI technologies, as well as all the new types of generative AI tools?
Yulin, thank you very much. It's quite interesting because when I began, we didn't talk about AI. We were actually talking a lot of big data resources and big data for health. And we were realizing how, for example, health data was not anymore only the things that we found on health resources, strictly speaking, but we could see how health-related data started to diversify. And of course, after having the data, then what you do with data is what AI has become like very interesting and very hot at this point. It has also increased our possibilities immensely. And all this data that was out there finally has a way in which we can understand or interpret or produce knowledge out of it. So for me, it was very interesting, really, that when I started, it was just big data, and now it's AI. Of course, AI is just one of the technologies. There are also other ways in which you can process health data, but that has changed a lot. For me, it's also quite amazing you mentioned generative AI, to see how quickly a particular event just changes completely the landscape. So I think generative AI was out there, but then when ChatGPT was finally released, then we've realized the power that it had. I think that's also quite amazing to realize how quickly the rules of the game change and how difficult it is to keep legislation when things change so fast.
You're based in Europe. How do you feel that Europe has taken AI in terms of the legislation for it or against it? And if you have any comparison to what you know about the U.S., how do you feel Europe has adopted AI in its legislation?
Yeah, so Europe, I think, has made a massive effort. First of all, Europe being more a region than a country, that needs also to set some kind of rules to be able to work. So I think at that level, the European Union has served a lot to try to bring forward new legislation. So we started with the GDPR, for example, the General Data Protection Regulations. Then shortly after, then we also had the MDR, the Medical Device Regulation. The AI Act was just recently published. It will come into force, I think, in 2 years' time. The AI Act is the European regulation for artificial intelligence. This liability AI Act is also coming up. So I think the response has been quite loud and clear. So it's not only leaving to member states to do what they think should be done, but also set the rules of the game so that Europe can stand as one regarding AI. The challenge is that we're talking about a digital technology, so that means that it's a cross-border technology. So it's really hard to contain or maintain. It's not like goods as we did before. We have also seen over and over again that there is a risk of harm. And usually the ones at most risk are the ones that are the most vulnerable or the ones that cannot defend themselves. And that's something that we would like not to see.
Can you tell me of examples that you've seen where vulnerable populations have, been hurt by these technologies, and how you want to see ethical frameworks be put in to prevent that from happening, and how you do that?
Let me tell you one story about Holland, how things didn't go right here. So there's a huge scandal because the government thought that people were doing fraud regarding social help in Holland. So they used an automated system, an AI system, to be able to flag who was doing this. And really big fines were given to a lot of people. That meant that a lot of people of low resources could not pay the fines. Children were taken out of their homes. Families were separated. People were put in very difficult economic situations. And at the end, when they were revising the cases in court, they realized that this was actually not the case, that these people did have all right to social help. but the system didn't flag them correctly. And this is a massive problem which is still not completely solved in the country. So as I mentioned, there are other examples of it, but I think in Holland, this is like the iconic example of how things can go wrong.
So what was wrong with the system? Was it an algorithm? And do you think that all that was needed was a better algorithm or system to be able to flag it better, or that it shouldn't be used at all? What are your thoughts?
Yeah, so I can understand that it's a massive human effort to go file by file, taking financial information. Holland tends to automatize a lot of the government tasks, so I can understand that from that perspective. Now the issue is, independently of how good or how bad the algorithm was, then the questions are raised about how was this actually tested before deployment, and what was not done after it was deployed to really check that it was flagging people correctly. And I think that this is a very nice wake-up call for what we do in medicine and in health. The fact that maybe something works very well at the beginning doesn't mean that it will perform the same way during years or during a long time. It's not only the quality of the system at the moment where we deploy it, it's not only the populations or the context in which we are deploying it, but it does require a big effort to follow up the AI system throughout the whole life cycle. Sometimes people are very sure that the AI systems are good and they perform really good and they perform better than anything else that is out there, including humans. But the problem is that it's not only that. Humans are in the equation, and we will always introduce a high level of variation and unexpected things. That's just how we work. For example, the population can change or your algorithm can change, and at a certain point may not perform as you expected anymore. And if you just assume that it's good, that it will always be good, then at a certain point something is going to go wrong.
I think that we've seen that a lot in medicine, where you have these risk scores, for instance, that were developed on certain population groups, and like the Framingham risk score developed in 1960s on a population that's still being used across different population groups now, and a lot has changed, right? And so we do need a system to be able to measure and update it. But let me ask you, what measures can ensure that we are constantly checking on these systems? Is it another AI tool, or are we going to have to develop another AI tool to check up on this pre-existing algorithm to make sure that it's current and relevant?
I must confess that I wouldn't think the first solution would be that AI should control AI, because you would just always generate this dependency on technology over and over again, and at a certain point would become very difficult to actually realize where or when something went wrong. I do think that also from the European Union there is this idea of human in the loop or human in control, and I think depending on your risk-benefit assessment, that will probably always be needed. And if you're talking about AI systems for healthcare, I think very few people are actually trying to push AI systems that are totally automated or that can take decisions or make decisions on their own. I think in health, maybe in other fields, this is more accepted, but at least in healthcare, that will be very difficult. But you asked me about bias. I think we cannot think that our AI systems will not be biased. I think that is the wrong way of going around things. We need to assume that there's a risk of bias. Even if we think it's zero, there is a risk of bias. There will always be a risk of bias. And as long as we are aware that this risk exists, then we can take measures to try to measure it, to try to detect it, to try to correct it, and to try to avoid damage. Or in the case that damage has taken place, then do something about it. I know there are, for example, technical measures to ensure that your data is representative and that your data is good enough, that the quality is high enough. And I'm not saying that this is not worth doing. I think you should definitely do it. But what I would like to say is take into account that also, because as we mentioned before, things can change unexpectedly. Your AI system may develop to places that you did not expect, that your population may change, something in the environment may change. This bias may appear in the moment where you don't expect it. So I think it's a combination of technical measures, but also continuously monitoring your AI system and how it is performing. And if you're changing something, if you're, for example, applying it to another context, just don't assume that it's working in the same way.
And so let me switch gears a little bit and then talk about this article that you recently had in JAMA Network Open. It was a systematic review, and it was trying to underscore the need to facilitate transparent and consistent reporting of quality criteria for machine learning algorithms. Can you talk a little bit about the study itself and how you feel that the importance of this transparency is and how it might help this idea of ensuring that we're constantly measuring the quality of these algorithms?
I think what was a little bit shocking was to realize how little evidence it is available when you're dealing with AI systems, especially when you're talking about commercial products, because at the end of the day, that's how they're marketed as products. It is really frustrating as researcher, for example, when you're being asked to validate an AI tool and you have no evidence of how it has been put together. You have no idea from implementation side as well what has been done. Many times as researchers, we realize that there is an issue with the amount of information that is out there about the systems that you're supposed to research. Now, the other part of it is that, for example, I work in an academic medical center, and there is a whole process for buying or acquiring AI systems or technology in general. This decision making has also to be based on something. And I would like this process to be based on evidence. Now, the problem is that the only evidence that you have are the reports that manufacturers want to provide. And of course, their quality, for example, the CE mark in Europe or the FDA approval in the US. So, of course, that helps. That tells you what kind of AI system it is, and it tells you some performance measures, etc.
There is obviously the importance of reporting, but then at the same time, how do you balance that we as AI developers ensure that evidence for each life cycle phase of an algorithm is reported, but then how do we balance that with not compromising proprietary data or intellectual property for the business purposes?
That is a very interesting and very difficult question to answer. I think my first limitation is that I have no IP rights to protect. So it's difficult for me to really put myself in the shoes of people that depend on IP rights in order to make the business work, and livelihood also depends on that. But I don't want to say that that's not important. We work together, for example, with a small company, which is with whom we're doing research to develop AI systems for low resource settings, specifically in Africa. And I have felt this tension. Like we are doing research and we're putting data in the public domain, for example, and we want things to get better in low resource settings, and we want to help healthcare systems in low resource settings to be better. But if we don't bring this to the market, we will also fail. We don't want to fail. So the problem is that we have not started a conversation about what kind of information is the basic information that we should provide. In that respect, maybe legislation is helping us a little bit. So the AI Act, for example, establishes that a database will be put in place for the EU, and high-risk level AI systems and also other systems like the ones, for example, that are medical devices would be included in this database, and that information will be standardized there. So I think from the regulatory bodies, we are seeing that this need is not only from our side, but also has been picked up at a higher level. And I'm really happy to see that it has been picked up. However, for example, the AI Act is quite recent, so we really don't know what is going to be the impact of this in the future. And we saw the GDPR had this kind of growing global effect. So on one side, I would like to think maybe the AI Act would act similarly, maybe would push the market and the regulation in other regions as well. But again, this remains to be seen.
Well, thank you very much. This was a really insightful interview, and I do really love everything that you've said, and it's really resonated with, I think, a lot that's happening within the U.S. too. So thank you very much, Maria, for your time.
You're very welcome. It's also a pleasure for me to be here.
I am Yulin Hswen, Associate Editor at JAMA and JAMA Plus AI, and I've been speaking with Dr. Maria Villalobos-Quesada on the bioethics of new technologies in Europe and across the world. You can find a link to the article in this episode's description. And for more content like this, please visit our new JAMA Plus AI channel at jamaa.org. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Shelley Steffens at JAMA Network. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.